Hi, I'm Dr. Johnny, and today we're talking Botox. If you're a provider of aesthetic services and Botox-like treatments, and you go to a party and people say, what do you do? A lot of times I'll be like, I'm a graphic designer, or I'm a YouTuber, and those are all kind of true things. But if you say, and sometimes it's called flooding in the psychology world, you say, I inject Botox for a living, everyone's like, whoa, oh my. Or if you say I do fillers and Botox or aesthetic services, you get 15%, 25% of the people, depending on what part of the country, even 60 or 50% of the people will be like, wow, what do you, tell me more. How does that work? And you get the majority of people somewhat disgusted or fearful or, oh my God, toxin, you're injecting toxin, what are you doing? So it's very, very interesting. And that stigma, I'm going to show you today what Botox is, what it does, and a bit about the safety, but that stigma is something that still lives with it, with aesthetic services. Why is that? So let's get to this video. What I'm going to do today, I'm going to show you a great before and after. So you see what Botox is, what it does, what it's meant to do, the safety, and what it isn't. And I'm going to do all that in a few minutes and hopefully keep you entertained with it. Most people are here for the before and after. They want to see before and afters. Botox is part of a complete face treatment. Let's get right to this video. Thanks for joining me. In 3 seconds, we're on it. Okay, so Botox. I started using it in the late 90s, 2000s. It's been around since the 80s. And it's one of the most studied drugs on the planet Earth. There's thousands and thousands of peer-reviewed articles. Why are people scared of it? But they're taking their vitamins and they don't know where they're made. They're not FDA approved. The FDA doesn't take approved vitamins or regulate them, okay? They're supplements. And people are on all kinds of things, they're ingesting their toothpaste with parabens and everything else, but they're scared of Botox. It sits with it. Part of it is that it's an aesthetic service, it's not necessary, and of course it comes from botulinum toxin type A. In this country, we have several. We have Botox, which is a brand name like Kleenex, like Crest, like toothpaste. So it's a brand name. But Botox, Dysport is number 2, then Xeomin, and then jeuveau. So we have 4. Now, it's important to understand what it does, and this is where the before and after comes in. So let's get right to it. Let me show you. When you see the before picture, you see in the frown, it's still our number 1 area to be treated, you see full movement. You see full contraction of the muscle. The muscles are the procerus in the center, the corrugator, and then the lateral corrugator, the tail. And we treat all of these. Sometimes we don't treat the lateral one. Go to my video and you can watch the Botox lid droop. It can cause lid droop, but also watch the one on the Botox brow droop, because that's more common and it drops the brow. When you see, now you see this before picture, you see the muscle movement. Go to the after and you'll see there's less movement. There's just not a frown. The patient's trying to frown, but she cannot frown. And that same loss of movement occurs in the forehead, and when you can't lift, you droop. And you'll see that in my other video. So now you know what it does. It slows muscle movement down. What's all the hype about this? It's a drug that's one of the most studied on the planet Earth, that thousands, millions of people do every year and have done to enhance aesthetic appearance, to help with depression, to help with headaches, to help with spasticity, many things. But now that you see what it does, let's talk about how to do it, what it doesn't do, and why the stigma is about it. So it stops wrinkles, and that's part of it. When you stop the muscle movement, stops the wrinkles. The canthal folds, or the crow's feet, the forehead, and the glabella are the most common. Masseters, it can shrink them. The downturn of the mouth, the chin, the peau d'orange. And you can use it in other areas as well. The nasalis, you can use it to decrease oil production, decrease pores, and just help smooth the whole face. There's microtox, you can watch my video on that. Many ways to use it, but a lot of people believe that doing aesthetic services is a bad thing. It's still taboo. When people feel better about themselves, when they're more relaxed in certain areas, when they have less lines and folds, they're more confident, they're more successful, and a small thing like a few $100 Botox treatment can make a big difference in someone's life. And just take the frown. People look angry when they're not, when they're frowning. So when they stop frowning, or the inability to frown, that just a general habit opens the eye, makes them more rested, and people approach them more. So there's many benefits. Now that you know it stops muscle movement, that's the only way it stops lines. It doesn't build collagen. Go and watch my video on Botox Dirty Little Secret. And that's going to show what it doesn't do. And what it doesn't do is make you look younger, in the sense that it doesn't build collagen. It's not going to really tighten the skin. It just slows the muscle movement down. So it's kind of a band-aid. So know that ancillary services such as collagen stimulators, such as microneedle radiofrequency, IPLs, skin tightening, all those treatments are an adjunct to it. If you use it as a standalone, you'll be sorely disappointed. If nothing else, use your sunscreen to prevent photo damage. So topicals and skincare help, but know that that's what it doesn't do. And tell me if you're, especially the female injectors, do you get the same response I do when you say what you do for a living? And that's what you do. And all the stigma about Botox, all of this for just decreasing the muscle movement to help someone reduce their lines, decrease tension, and to help them give the appearance of a more subtle, refreshed look is a good way to put it. Now, when people are doing weird lip fillers, weird cat cheeks, when they get duck lips, that's a whole nother story. But doing Botox to refresh the skin, to decrease oil production, and work along with your other services to produce subtle results is an amazing procedure. What do you think? Join me here. Click like if you like, subscribe, it helps the channel. Smash that like button for our YouTube algorithm, and enjoy my further videos. When you subscribe and click the bell, you'll be notified. I do Instagram lives, do many conferences, and you'll be able to join along with me with all the services that I'm going to talk about to help keep your skin and body beautiful, healthy, and vibrant.